Hey there, it's Kristine from Nurse in the Making, and today we're going to unpack the complete NCLEX Pharm Flashcards. I created these cards because so many students struggle with pharmacology. There are so many medications to know, medication classes, signs and symptoms, treatments. It can get really overwhelming. Thousands of students have already started using these and studying from them. I remember opening my pharm book and seeing at the end of every chapter a long list of medications. I felt so defeated, like, how am I ever going to pass this class? On top of knowing all those medications, you have to know the actions, the uses, the side effects, nursing considerations, patient teachings, generic names, and trade names. So, to say the least, it was a very difficult class for me, and I know a lot of students struggle with it as well. That's why I created these flashcards. They're full of memory tricks, mnemonics, and visuals. It contains 110 of the most common medications you'll see on the NCLEX and taught in nursing school. Plus, I also include the most common antidotes. It includes a ton of topics, and it's organized by section dividers, which are included. They're really easy to place in your flashcards. This way you can see the different sections like cardiovascular, central nervous system, immune, mother baby, musculoskeletal, gastrointestinal, endocrine, respiratory, renal, and antidotes. I'll show you an example of what a card looks like. It includes medication class, the therapeutic uses, the generic and brand name medications with common suffixes you'll see throughout the medications, if there are any antidotes, therapeutic ranges. I also include important NCLEX tips. This is where you're going to find fun mnemonics and visuals. It also includes patient education, which is really important. On top of all the medications included in the flashcards, it has some of the most common antidotes, and almost all of them have fun memory tricks. Okay, so how do you actually use flashcards? Well, first off, let me say flashcards are not intended to be a place where you learn the information for the first time. It's meant to review the information. So for example, once you feel like you know all of your cardiac meds pretty well and you want to pull out your flashcards and test yourself, this is the perfect time to use your flashcards to test yourself and review. I always talk about the power of repetition. I know for me, I needed to see something multiple times in order for me to remember it and it to be engraved in my brain. It's so important to step away from reading your textbook and actually test your knowledge on what you know. So when I say you want to use these cards to test your knowledge, let me show you what that means. In the front up here, it asks you questions like, what is a medication class? What is the therapeutic use? And what are the suffixes and prefixes, important NCLEX tips, and patient education. So you're gonna go down the list. For example, ACE inhibitors. What is the medication class? Well, the medication class is antihypertensives. You're gonna turn it around and you're gonna see that you got that answer correct. So basically it's like a mini quiz, and when you turn it around, you're gonna test yourself. That's why I made these flashcards, so you can review. Repetition is so important, and sometimes it's really important to take a step away from reading your textbook over and over again and quiz yourself with flashcards. You can find the Pharm flashcards and other nursing school flashcards in my shop, Nurse in the Making. The link is in the description below. Happy studying, future nurses!